Hey everyone, welcome back to another Intulect nursing video. Today we're going to go over cholecystitis or cholelithiasis. We're going to go over the pathophysiology, the risk factors, the complications, the signs and symptoms, the management, and the nursing diagnosis. Let's get right into it. If you haven't already, make sure you go to your pathophysiology concept maps located in your courses. You will find that within the gastrointestinal system pathophysiology concept maps. This will help you follow along and take notes additional to what we go over today. So first, let's define cholelithiasis versus cholecystitis. Cholelithiasis, when you see that term, that's mentioning that there is a presence of gallstones or calculi located in the gallbladder. Versus cholecystitis is the inflammation of the gallbladder or the gallbladder duct. So they kind of go hand in hand most of the time, but just so you understand the difference between those terms, it could be important in some of your questions that you see on the NCLEX or the nursing exams. So the general term you may hear out there is like a gallbladder attack or gallbladder colic. This is usually related to cholecystitis. So we're going to go over the pathophysiology first, and then we can go straight into signs and symptoms, risk factors, and complications. So you'll hear the word calculi. So that refers to calcium or cholesterol formation into a hard stone that gets lodged within the gallbladder. These calculi, or crystals you could say, are getting so big to the point where they won't pass the cystic duct of the gallbladder. So what this can lead to is things get backed up in the gallbladder, which leads it getting backed up into the liver. And once the filtration of the liver gets backed up, then you're going to see increases of bilirubin in the bloodstream, which then results in increased peristalsis of the gallbladder because there's some compensation that is occurring, which is usually when you have that gallbladder attack. And all of this can impact your metabolism, especially fat metabolism. And that is because the bile that gets released into the gastrointestinal system is responsible for absorbing those fats and using those as nutrients for our bloodstream. When we don't have that bile, we lack the ability to absorb those fats, which you may see here in a little bit. We're going to go over signs and symptoms, some impacts of that. Before we get into signs and symptoms, let's go over the risk factors. So who is likely going to have these issues? One of the ways you can remember the risk factors is remembering the 4 F's. So the 4 F's includes fair-skinned, fat, female, and fertile. So it's basically referring all together the ethnicity, the gender, the age, and the lifestyle. So those who are obese and those who eat a high-fat diet are at risk for cholecystitis. And it's not necessarily the high-fat diet, it's more of a high cholesterol diet that's more directly related to this. And of course, another risk factor is diabetes, as this is more likely to occur with these kinds of patients. And then rapid weight loss is actually another risk factor. Someone who has been obese most of their life and they rapidly lose weight, well, there is a chance where the gallstones could end up forming at that point because a lot of it's getting excreted and metabolized through that system, and you could be causing some calculi in there. And because of all that, it ends up blocking that cystic duct. So what are the signs and symptoms you'll need to know for the NCLEX and the nursing exams? The most common ones they'll test you on is knowing that if it's on the right upper quadrant, pain, so it's an acute, severe right upper quadrant pain. We have hypoactive bowel sounds because the bile is not getting into that digestive system, and it's not so much is going on in there anymore because the bile is responsible for fat metabolism and absorption once again. So you could have hypoactive bowel sounds. And one of those signs that they'll commonly ask you about is called the Murphy's sign. So basically, when you press down on the right upper quadrant, it's going to cause severe pain. And this pain is characteristic, especially when they take a deep breath. That severe pain comes on suddenly and takes their breath away. Another sign is called a Bloomberg sign, which is basically rebound tenderness. So when you press down on that right upper quadrant, not necessarily is the pain there when you press down, but when you let go, the rebound tenderness there is when the pain occurs. Another very common sign and something you'll need to know about is clay stool. The reason why their stool is not brown and it's clay is because what makes the stool brown is bile. So the bile is missing in this case, so there's a blockage in that gallbladder preventing bile from getting into the gastrointestinal system. Well, their stool may be clay colored instead of brown. If it is very severe and if it's been going on for a while, you're going to see possibly dark urine and jaundice because of the high bilirubin contents in their bloodstream. And during gallbladder attacks, of course, you're going to see some severe pain. They're going to be maybe pale and they're going to be very sweaty. Now, a telltale sign that you'll need to know, of course, we know about the right upper quadrant pain, but if it's during or after a fatty meal, this is a very significant sign of cholecystitis. And that is because when they eat a fatty meal, that of course stimulates the gallbladder to release bile into the gastrointestinal system, but it can't. So once that peristalsis happens in that gallbladder, that's going to increase the amount of pain because it's already inflamed. So once it's trying to contract and get bile into the gastrointestinal system and there's a blockage going on, it's going to increase that pain amount. So if left untreated, what are the complications of cholecystitis? One of the worst things that could end up happening and why general surgery is usually required for this is perforation, and then if that perforation happens, then likely peritonitis. If that gallbladder perforates and releases that content into the open abdominal cavity, that will cause peritonitis, increased inflammation there, and of course a very likely chance of infection. So all of that is of course a very severe result or a complication, because then that could end up causing sepsis, which sepsis is an infection getting into the bloodstream itself, which is a severe complication. Other complications include gallstone ileus. That is basically tissue ischemia of the gallbladder itself. You could have a fistula form, which is an entry to another part of the abdominal cavity, which is not supposed to occur. And in very severe cases, we talked about how the liver filtration will get backed up. Then of course, if it ends up being pretty severe, jaundice can happen as one of your signs and symptoms. You could have some potential liver damage going on as well. Now, when you're doing your diagnostics of a patient, so you did your assessment, they're showing signs of cholecystitis, what are those diagnostics that may help confirm your diagnosis? So that would include an increased ALP. This is a liver enzyme that's specifically related to the gallbladder itself. Now, you'll likely see all of your liver enzymes increase because that backup of the liver is going to cause some damage in the liver itself because there's nowhere for that filtration to go. But the ALP specifically is pointing towards your gallbladder. So if that's really high, then you're likely looking at a gallbladder issue, so a cholecystitis. Of course, you're going to see increased bilirubin, as we already said, and you're likely going to see a high white blood cell count as well, because this is an instant and an acute reaction here, and it's going to cause some inflammation there, so likely you're going to have a high white blood cell count. Now, some imaging is usually going to occur. They're usually going to do an ultrasound to take a look at the gallbladder itself because that's the least invasive. If it's non-conclusive, they may escalate that imaging to, of course, a CT scan or an MRI. But usually those are the things that would be able to help you confirm that this is a cholecystitis case. Now, as the healthcare team, what would we do to manage it? So, of course, we want to manage the pain at first, so we were going to give them pain medication. We're going to be giving them antibiotics to prevent infection. And if the gallstones are unable to be passed, surgery is required to remove those stones. And if any damage happens to the gallbladder itself, or if it's unable to remove those stones directly, then they will remove the entire gallbladder. Now, since they are not able to digest fats or absorb fats in the digestive system, then you're going to be giving them fat-soluble vitamins, which is your A, D, E, and K. So vitamins A, D, E, and K, we may be supplementing them while they're in the hospital, not usually before the surgery, but usually after the surgery now that they don't have the gallbladder. So as the nurse, when you're at the bedside, what are some things that you can do intervention-wise for a patient with cholecystitis? So first things first, you're likely preparing this patient for a surgery. So you're going to make them MPO, you're going to control their pain. And then after the surgery, of course, you're going to be encouraging breathing exercises, doing all the things post-operation that you would typically do for a patient after any surgery. And you'll definitely want to monitor their weight, their intake and output. And then for discharge, you're going to educate them on their new diet and lifestyle. So of course, one of those things is going to be supplementing with those new fat-soluble vitamins that they're definitely going to need. And of course, educating them on any complications that could occur at home, which is the same complications we just went over a little bit ago. All right, guys, that ends the cholecystitis video. I hope this video was helpful. If you want to see more videos like this, make sure you go to our YouTube channel or go into our courses to figure out what other videos may be helpful along your journey with the NCLEX or the nursing exams. Thank you all so much for watching. I'll see you in the next one.